Hello friends, I am a student at the Universidad Católica Santiago de Guayaquil. My name is José Antonio Barragán and my topic is Selumetinib in the children with the inoperable plexiform neurofibromas and my three social networks. Definition: neurofibromatosis is a genetic disorder of the nervous system that primarily affects the development and growth of neural cell tissue.
In NF1 patients, we frequently see a lot of cutaneous tumors. These are neurofibromas. Depending on the location, they can be either more superficial or more deeply seated, which can be very disabling for the patients. And these tumors have the propensity to frequently become malignant. There are also other tumor types affecting central nervous system. In neurofibromatosis type 2, we typically see different kinds of tumors. The most commonly seen tumor is an acoustic schwannoma.
My name is Dr. Radhika Damija. I, along with Dr. Mrugala, co-direct the Neurofibromatosis Clinic at Mayo Clinic in Arizona. We've put together a multidisciplinary effort to take care of patients with both neurofibromatosis type 1 and neurofibromatosis type 2. Both these conditions are genetically and phenotypically very distinct. These patients often have complex needs and need a multidisciplinary care.
At Mayo Clinic, what we're really best at is complex care. And this is a great example of our ability to truly translate idealism into action. When you come to Mayo Clinic as a neurofibroma patient, you're going to get to meet all of your specialists, and where plastic surgery comes in is helping to plan the incisions, helping to execute the operations, and helping to ensure that that patient gets the most aesthetically pleasing outcome at the end of that operation.
Our goal as neuro-oncologists when we work alongside of the neurosurgeon is to make sure that we're able to maximize the amount of treatment the patient is able to receive, specifically surgery in many cases, while preserving their neurologic function. We're so fortunate here at Mayo to have a proton beam facility, and there are certain instances where proton therapy is even far superior to typical photons. Having the ability to collaborate with the different specialists really helps us make sure that we're able to take the best care of the patients, and also to make sure that from a neurologic standpoint we don't lose sight of who they are as a person and what's important.
For more information on this condition or to refer a patient to us, please call us or visit us at mayoclinic.org.
Okay. Application in medicine. Selumetinib, sold under the brand name Oselugo, is a medication for the treatment of children 2 years of age and older with neurofibromatosis type 1, a genetic disorder of nervous system causing tumors to grow of nerves. It is taken by months twice per day on an empty stomach.
The first good news was that we actually saw tumor shrinkage in almost every every patient that we enrolled. And this shrinkage was not dramatic and large in most patients, but it was measurable. And this is something we had never seen before. And what is important here is that we treat young patients, and most of these patients have tumors that are growing. And so even if we see shrinkage that is minor, what that implies is that we don't see growth. And in my mind, stopping a tumor from growing in and of itself could be benefit because we prevent complications that may happen. Our phase 1 clinical trial of the MEK inhibitor had the primary goal to really identify what is the maximum tolerated dose that we can give to these children who will have to take this drug for a long period of time. What are the side effects that we see? And in addition, how does the patient handle the drug? We call this pharmacokinetics, where we look at the plasma concentrations over time. In addition, as a secondary objective, we also wanted to look at what does the drug do to the tumors of these patients. Patients with NF1 have sometimes very large, disfiguring, painful tumors called plexiform neurofibromas, and we measure these tumors with a method using volumetric MRI analysis. Of importance is in many clinical trials that I've done in the past, we have not seen shrinkage of the tumors, and we have not seen that the medicines that we tested would delay the time to progression. So overall, most of these studies were negative. And my expectation going into this phase 1 trial with the MEK inhibitor was, of course, we always hopeful that something else might happen, but we didn't really, to be perfectly honest, expect it. We have studied these tumors at the NCI for a long period of time. We've developed criteria how to measure these tumors. We can sensitively measure changes over time, and we were able to implement meaningful clinical trial designs. This all kind of led up to us being able to really understand what is going on when we give new agents, and shows a prime example why the NCI is doing these studies. I do feel we have made substantial contributions here that would be really difficult to do outside of the NCI intramural program.
Pros and cons. Treatment of neurofibromas in people with neurofibromatosis. Its pros. Selumetinib has also been shown to inhibit the growth of melanoma cell lines. Pros. And cons is selumetinib can harm a newborn baby when administered to a pregnant woman, can cause serious side effects such as heart failure.
My name is Jane and I have neurofibromatosis type 1.
So Jane had been on a couple other clinical trials that weren't working, and she was invited to try the Selumetinib in the phase 1. So she was one of the first 24 kids that actually took the medication, and that was, I want to say, about 6 years ago now.
Well, at first, I guess, from preschool through kindergarten, I was bullied because of it. And now just people are wondering what it is.
And we've had good success with it. She had a big drop in her tumor size, and it's sort of been stable since then.
It's exciting, yes, because I don't want kids to, be bullied at all because they're different and they look different. So I think it's exciting, yeah.
Thrilled that it's kept her tumor from growing any further, and really the side effects have been manageable. It's fabulous to see, starting phase 1 and coming all the way through to FDA approval. It's amazing. We've been through the whole thing. So currently there's, if someone walks in off the street with NF or a plexiform neurofibroma, there's nothing for them. The only way right now you can get treatment, other than surgery, is through a clinical trial. But once they get FDA approval, it's something that any physician who takes care of a patient with NF can prescribe.
Just because it affects my visible appearance doesn't mean it affects me on the inside at all.
You can get the benefit of the medication without having to, say, travel to DC like we have to, or participate in a clinical trial and all that involves. So it also means that it's here to stay. If the trial's not going to end, and you're not going to be left hanging with no treatment. Thanks to Selumetinib, Jane's tumors shrunk more than 25% and stayed stable, and so we're just thrilled that that's one less thing we have to worry about with her NF.
My name is Jane, and I want you to see me and see NF.
Issue applied in Ecuador. The Ministry of Ecuador evaluates the situation to be obliged to fight the neurofibromas disease with the necessary medicines that the World Health Organization decrees.
Well, so Summit trial is basically trying to address a real unmet need in our patient population with melanoma. Ocular melanoma is a very unique subset of melanoma that has proven to be very treatment refractory when compared to cutaneous melanoma. And thus far, we don't have an effective approved systemic treatment options for patients with metastatic disease. So Summit was basically building on preclinical data and clinical data showing that MEK inhibition in this disease, which is driven by mutations in something called GNAQ and GNA11, which activate the MAP kinase pathway, would be an effective therapy. And so Summit was really the phase 3 trial trying to test that concept. What we did was we combined Selumetinib, which is an oral inhibitor of MEK, with chemotherapy dacarbazine. And so patients were randomized to either that combination or the combination of a placebo and DTIC. And the primary endpoint of this trial was progression-free survival based upon blinded independent central radiology review. And unfortunately, what we saw was that there was no difference based on that blinded review. The progression-free survival, if we look at medians, was improved from 1.8 months with the placebo chemotherapy arm to 2.8 months with a combination. And so there was a trend towards a benefit. This did not meet statistical significance, unfortunately.
Conclusion. Selumetinib is the drug that has been shown to be the most effective against neurofibromatosis, and nowadays its use in control while giving good results. Thank you very much.